Connecting with Pets, a Forever Vets podcast.
Welcome back to podcast episode number 15 of our season 2 of the Connecting with Pets Forever Vets podcast. Today our topic is urgent care visits versus general practice visits. My name is Shelly, and today joining us today is AJ from our Emergency Central location. Thank you for joining us.
Thank you for having me. I have been with Forever Vets for 5 years. And as far as managing goes, I started from general practice, the 2 general practices, and now I'm here at the urgent care. So definitely all kinds of experience, and it's been very rewarding to see all the growth.
Thank you for giving us a little brief journey of your history with Forever Vets. Now let's take it back a little bit. How long have you worked with animals in general? And can you give us a little behind the scenes of what your previous work history looked like?
Well, it's been a long time. So I've been in the field for 15 years. I started as a pre-vet student that really just needed to require hours for my vet school application. I've always loved animals from a very young age. I am from Medellin, Colombia, so I used to be the one that used to bring all kinds of different stray cats and dogs, and with the idea and the excuse to find them a home. And so, my parents always understood that, so that's when I really started.
Your passion with pets.
Yes. Now, my first vet tech job was in a corporate practice. I did that while I was going to school full time, and I did that for almost 4 years. It was a very high volume, fast paced environment. So really just I had to learn. There was no other option, learn a lot from my time there. And really just from there, my love for vet teching really started and kind of grew from there. So after that, I graduated with my animal science degree, and with the idea again to just apply for vet school. I was about 2 hours away from Jacksonville then, and then when I moved back home, I started a job as in a private practice.
Okay.
There I did that for about 3 years or so. And I decided that vet school wasn't really something that I wanted to do long term. The reason for that is I think when you pause and really are able to help people from a different angle, not as a doctor, but more so being that bridge between the clients and your doctor, and understanding the struggles that a pet parent goes through and being there for them. That was really why I said I'm going to stay in this field, because I love it very much, but also do it in a different way, helping people and animals in a different way. And then after I basically got a lot of experience from general practice, both private practice and just corporate, I decided that I wanted to go into specialty. And so I was an ophthalmology tech for about 5 years. And then really continue to learn all the things that involve, eye conditions for both cats and dogs, and then really learn some more things about internal medicine. So that was definitely a great experience as well, because it opened my eyes to, what's out there. There's so many things that we can do for our dogs, and so many different types of specialties that are available for our cats and dogs, and that some people are not really truly aware of.
Yeah. So jumping into the set of questions, and now knowing more of your history before Forever Vets and kind of why you continue to stay in VetMed overall. Jumping back to the main topic of this, what would you say the difference is between an emergency and urgent care visit versus a general practice visit at a veterinarian's office?
So I always tell people, just it's the same thing with us. So think about, when you go to your doctor for a wellness visit once a year and you need blood work and, your yearly exam or your every 6 months dental cleanings and things like that. So it's the same thing in veterinary medicine. We want to make sure that we provide, preventative care or wellness visits. So that would be what your general practice is going to do. So they're there to prevent, things from happening. And our general practices do a really great job with, doing blood work once a year, and doing your dental cleanings once a year when necessary. Because doing those things, you can really find abnormalities with like your levels or their levels of their blood levels, or you can really find things that may not be symptomatic yet. And early diagnosis is super important, and sometimes can be detrimental to again the outcome on anything that we notice on our pets. So that's super important. So preventative care, I would say, if you do have your general practice or down, that's where you want to start when you have a pet, is really establish the wellness visit.
The wellness plans and things. Yeah, we talked about that a couple times on the show. So those are more of just a preventative care, routine checkup kind of thing is what
Correct.
General practice is.
Yes. Now, as far as urgent care emergency visits, they're usually for situations that happen when, your general practice is closed, when you can and should not wait to have your pet seen, because again, there is certain things that you don't want to wait until the following day. So things like excessive vomiting or diarrhea, or if your pet is extremely lethargic when you come from home and they're not really acting like themselves, if they're very pale, and not acting right, or any type of toxicity cases, you don't want to wait until the next day to go to your general practice. Obviously, if this happens during the day and your general practice can get you in, we can have you go there, but that's why we have urgent care and emergency, is because that's literally all we do, is take care of those emergencies.
It seems too, emergencies always happen when you least expect it, and most of the time what I've noticed is a lot of other practices might be closed, or it might be an inconvenient day that normally general practice is closed. So it's nice to know that you can still take your pet to a different area and with those extended hours.
Yeah, definitely. And, we tell clients too, I do work with my receptionists, every week we talk about triage and the importance of triage. And so anytime that they answer the phone, they're able to determine the urgency of that case, and, whether they need to be seen in an hour or now, or, is something that can wait until the next day. So we work with clients and with the understanding that, hey, this is really something that you should not wait until tomorrow. We need to see you today or right now. And so triage is super, super important in that emergency call too.
Yeah, that's really great that you brought that up, because that kind of goes hand in hand with the second part of this question I wanted to ask is, as a pet owner, it's kind of difficult, from an outsider looking in from a medical side, of when and where they should go. So knowing that, is there any general fast tips you can give them?
So really just know your surroundings. I think you don't want to wait until you have an emergency to figure out where the closest emergency or urgent care facility is. So really understand where those locations may be. If it's 5 miles away, 10 miles away, you want to know that. You also want to call ahead. So always, if you can, obviously sometimes when we are in the middle of an emergency and we're, very stressed, very anxious, really trying to get our pets out the door, you're not really thinking about in what way you can help during that emergency situation. But giving your local emergency or urgent care a call will definitely kind of help you in that situation. If your dog is experiencing like respiratory distress, or if your dog is very pale or got bit by a snake or something like that, calling your vet and letting them know of the situation, letting them know, hey, I'm about 10 minutes away. I'm just letting you know I'm heading your way. This is my situation, because that really helps the team to be prepared for when you come in with your pet. What we do is we wait outside for the client. If the pet is not able to walk, we gurney the pets back, inside the building. Our medical team is ready and prepared, for really just jump in. So
pretty much as being a prepared pet parent is what you need to do, is have a plan, know your surroundings, where the closest vet may be if you're in that situation, emergency vet in that case, and just know that communication is really the key at this point.
Exactly. And then sometimes you do need that person that can kind of talk you through that emergency too and what to do. So again, my staff is that's what we do. We talk to clients, and sometimes it's very good to have someone on the phone to kind of like help you walk through that emergency, calm your nerves a little bit, assure you that, hey, you're doing the right thing, just head this way, and maybe help you through, again, getting to that location safely is the most important thing.
So moving along with our questions, I know that services here at Central, there's a lot of different services that are provided. But if a pet is having an emergency, what services here at Central can be provided to clients?
Okay. Before we even start and jump into that, I want to touch base on something that is very, very important, and is education. Even if you do have all the equipment available out there, but your staff is not fully trained on triage and just basic emergency protocols, then again, that kind of defeats the purpose a little bit of that equipment that you do have.
Absolutely.
If we don't make it to treatment kind of thing. So first and foremost, all my staff is trained. We do CPR training. They're certified to do that, from my receptionist to my technicians, and we work on that, and stay up to date with that. So that's very important. Now, as far as things that we do and we provide for our patients, we do have oxygen therapy. So if your pet is experiencing any respiratory distress, we can definitely provide assistance for that. Transfusion services as well. So if we get a baby that gets hit by a car, we're able to do that transfusion if needed. All the in-house diagnostics that we do have, so we get results in-house, anywhere between your regular blood work, clotting profiles. If we have any issues after a snake bite, we're able to get those results right there and there. We don't send a lot of things out, only if it's something that, again, we're removing a mass, and then we have to send it out to the lab for that. But most of the things we do in-house. We do have endoscopy, which is a very non-invasive way of removing foreign objects from the GI. So when your golden swallows a toy that is not supposed to, we're able to offer that endoscopy, foreign body removal. And so basically what it does, it just eliminates that post-op incision, and having to worry about the pain, having to keep your pet restrained for 10 to 14 days after that. So it's a very non-invasive way to retrieve that. We also have snake antivenom always available too.
Especially here in Florida with the summer months coming.
Yes. Springtime is usually a good time for that. So yeah, we have all those things available for your patients. We also offer non-emergency services, so things that can be scheduled that are a little bit more involved, and that should be done by a specialty practice, or somebody else that does have the equipment. So endoscopy, as I mentioned, is one of them, and we use it a lot for emergency situations. But we also do laparoscopy procedures, so any non-invasive biopsies, liver biopsies, any bronchoscopies, rhinoscopies, things like that. We do schedule, and a lot of the times we're looking for things like, again, It could be a foreign body, or it could be neoplasia or a mass or a tumor. And we do have digital cytology. So we're able to collect that sample using that non-invasive tool, which essentially is kind of a quick way to explain it is a telescope that access through a small keyhole, is what we call a keyhole procedure, through the body. And then through that, we're able to insert those instruments to collect those biopsy samples. And so your incision is going to be very, very tiny, and the recovery process will be a lot faster. So we usually recommend that for, older pets, or, if you want to just try to get your answers without being too invasive. And digital cytology is something that we can utilize to process those slides, or cytologies in-house. And then sometimes we do send them out too. But yeah, that's definitely another one. And then with laparoscopic procedures, spays is another one that we do offer, and it's something that is scheduled ahead of time. We try to do that during the morning when we're not seeing emergency cases. And that is essentially a non-invasive way to spay your female large breed dogs. So we're looking at dogs that are over 80 pounds or so. Your giant breeds are great for this type of procedure. So your Great Danes, Great Pyrenees, your Mastiffs, babies that are going to take really a long time in that recovery process.
So there's a lot of different services and options that are available, whether if you're looking to spay your pet or if you're not really sure what's going on. There's a lot of different tests and treatments that can be done in-house or at least scheduled in advance for sure here at Central, which is great. And you already answered this part of the question earlier before, but I wanted to see if you had any additional things you wanted to say. Any advice for pet owners who may be having an emergency and that are physically en route to the Central location?
So yes, so if you can call when you're in the car, definitely do that. So the medical staff is prepared for you coming in. The second thing would be just try to stay as calm as possible. We understand as your baby, we know the importance of, rushing and trying to get this treatment started and diagnostics started. So I would say, I know sometimes it's difficult, and every pet owner experience is a little bit different. But trust your medical team. We always look out for you and your baby. We educate. We try to ensure that you understand. If we do this, what would be the outcome? And our doctors spend a great deal of time talking to clients. Make sure that you make an educated decision about the well-being of your pet. So that's all I can say is, once you have your information, really just trust your medical team. They're there to provide the best care, and that's what we strive for every single day.
Continuing on with our questions, I know that there's a lot of services that we've discussed that our general practices do not have. Are there any services in particular that you can kind of walk through what that service or what that surgery or whatever it might be, what it would look like for a behind the scenes viewer?
We obviously get a lot of questions about our endoscopy procedures, so I'm going to start with that. We do use it quite often, and it's a nice little tool. Like I said, if we can do it in a non-invasive way, and really not putting your pet through all the recovery pain that goes after an exploratory open surgery, then if that's an option, we'll definitely offer that option. As far as endoscopy goes, there is one specific case that I think if you ask anybody that work at the Urgent Care Central location, they'll probably be very familiar with, and is this little Max. This little Max dog, Maltese mix, he actually has been one of the most rewarding cases that we had. And he actually came to us with a foreign body that was lodged in his trachea, right in his thoracic inlet. So it was a very tricky area because you can't really open that side. So endoscopy was the only option. This kiddo was about 15 years old, and again, still having an issue with ingesting foreign objects, which again, you won't think from an older pet. But he did, and he's ingested a bone that mom gave, and mom came in right away. We put him on IV fluids. He was with us for a good 12 hours before we went and induced for the endoscopy procedure. But in that process, it was a very hard object to remove because, again, of the location. But that's the only option we had. We were able to successfully remove that foreign object, and then he stayed with us for a couple more days, but then went home and, still I call mom and check on her every couple months and just make sure she's good. But yeah, he's still doing great. No more bones, no more anything like that. But essentially, the way that endoscopy works, it is a little flexible camera that has a light source connected to it, and then you project the image into a big screen, and you utilize these handles to kind of maneuver your camera through the again, esophagus down to your stomach. Very flexible camera. And so and then through that camera, you're able to insert your tools that will help you retrieve some of those objects. So there's different types of like little graspers. We have one that's it's almost like a sphere. It opens up and it collects like big objects like a tennis ball or something like that. So but again, it's definitely a new service that we offer, and we do see the great value in it when it comes to like patient care.
For sure. And how many endoscopies could you say that you've had procedures here?
3 a week, and we've been using it for over 6 months now. So it is some weeks we use it more often than not, but definitely one that we utilize a lot. Yes,
it's definitely a very unique tool and service to have, for sure. So we've talked a lot about Central, but I would love all of our listeners to know of why this particular urgent care, why Forever Vets in general is different from any other clinic that is around in the Jacksonville area.
I think our culture, and I definitely think our values, have followed us from general practice to the urgent care. And it's very interesting to see because, and I'm going to just mention the three that we really try to exemplify every single day that we work. And that is respect, compassion, and obviously we have to be optimistic, even in the most, difficult cases. For sure. Because that's what keeps us going. We can, and unfortunately can save every single pet that comes, our way. Obviously, there are situations that are very unfortunate, but again, we don't stop there. We keep trying, we keep pushing. As long as the client wants to continue, we will continue to work for that with the client. But again, sometimes the outcome is not ideal, and we know that, but it's still keeping that optimism going, understanding that clients that come to us, may not have all the tools and all the information at hand to understand what's going on, why their pet is in that situation, so really just be respectful of what they're trying to accomplish, and not judge, because we're so used to judging people based on what we know and what we think should have done. And I think really just kind of removing that, it's super important when it comes to emergency. And then compassion, again, being compassionate, not only towards the pet, which is super important, but being compassionate for that client. Sometimes that is the only thing people have is, they don't have, I tell my staff all the time, they don't have other family members, like that's their world. Mm-hmm. And so we have to be understanding of that and compassionate towards, that decision process too. So I feel like the main reason why we opened urgent care emergency within Forever Vets was to keep in mind not only to continue to provide care after we close at 7 p.m., but also to provide that experience for our clients, and that compassion and that optimism, in really be there for them regardless of their situation, regardless of their financial concerns. It's just provide that experience where they do feel that, We got you. As soon as you walk in the door, whatever it is, we will take care of it. We'll work with you depending on what's going on, what are your concerns. We'll take as much time as you need to process this kind of case, but that is why we are different. And it's funny that I always talk about this when I interview new employees for technician positions. I always tell people, this is a different environment overall, because we want, obviously patient care is 100% what we do, but also that experience, making people feel that this is a safe place, that they can let us know whatever it is that's in their mind, and that we're not going to judge them, that we're going to help them, and that we're going to be there for them. So
AJ, you've done a fantastic job answering all the questions that I've asked so far, but I would like to open the floor one last time to see if there's anything additional that you want our listeners to know.
Thank you, Shelly, for having me. So really just going back to being prepared, knowing where your closest emergency and urgent care facility is, staying calm, communication. So we are here. We're open 365 days a year, all major holidays. So when in doubt, always call, but we're here. Like I said, just be prepared, call us, and then we will be able to help you with anything that concerns you. So that is all I have.
Well, thank you so much for really breaking down urgent care visits and general practice visits, additionally giving us a more behind-the-scenes look of our emergency care center here off of Bay Meadows. If you would like to learn more about Forever Vets Central, please know that you can go to our website under our Central tab, or you can check out our Facebook page and follow along there. Thank you again for joining us for podcast episode number 15, season 2 of our Connecting with Pets Forever Vets podcast. We will see you next week as we jump into episode number 16. Thank you.
Thanks everyone for listening. We are Forever Vets, locally owned and operated in Jacksonville, Florida. Visit us at forevervets.com to find out more about our community events, monthly promotions, and more specifics on animal care. Don't forget to catch our episode next week.